Come on. Okay. All right. Okay. So as I said, again for the third time, is these are more skills that aren't as important. Well, they are important. I shouldn't say that, but they're not utilized as much in the group setting. These skills are used usually more on the individual level, but we will see that there are places where they do fit within the group setting. There are places these skills belong in. They're probably just not used as frequently. Okay. So the first one is something called focusing. Okay. And this is a skill, if a client brings a lot of issues to the session, it's about asking a client which issues is the most pressing. The counselor and clients have a clear understanding of what is being worked with. Usually when the major issues is the focus of the work, other than issues tending to fade away or resolve themselves, okay? And basically what focusing is, and I'll say that this happens a lot if you do some type of crisis intervention, if you're in the first or second session with a client and you've gained their trust, and they understand what the counseling process is about, is a lot of times they'll come in and give a list of 10 things that they would like to cover during their time with you. And of course, in that type of setting, addressing 10 things within a working session or a couple sessions is very difficult. So what focusing is it's listening to the client list all of these different things they have going on, and then it's asking them, dependent upon the time you have, which 2 or 3 are the most pressing, and then focusing on those 2 or 3 as part of what you call a focus or focus work, and saying, okay, you've just told me you have 10 different issues. Let's focus on 2 or 3. What are the most 2 or 3, or give it set number? What are the 3 most pressing issues? Okay. And what you will find is, by doing this, working on those 3 that are really pressing to the client, usually all of the other problems tend to be sub problems to those 3 main issues, and they can tend to resolve themselves. Okay. Sometimes, especially, clients feel relief when they finally have the opportunity within that first session, right? And so they pour out many issues very rapidly. Focusing is valuable here, but you may not be able to use it straight away. The client may need to first, and this is where you have to read them using those other skills we learned about tending and all those things, especially in the first few sessions. The client may just need to talk about everything that's going on and let everything pour out. And making sure that when this is happening and they just need to tell you a lot of things, kind of help them get pace, because if they start going too fast, you're probably not going to be able to attend it properly. So this skill is really good. When I did individual counseling, I usually started it in maybe like the second or third session. So they'd come to the first, maybe the second session, they'd be able to release everything going on and whatnot. And then around the second, third, maybe the fourth session, I would then use focusing and say, okay, hold on. What do you think are the most 3 pressing issues that we could focus on today? Okay. In the group setting, You can use focusing when you're doing things like client check-ins and all of these things, and all the people in the group seem to have all these issues going on, and you know that within that group time you're not going to be able to address it all in the group setting. But with a group, what you want to do is get kind of consensus with the group members. So we've heard what everybody is saying. There's some common things going on between some of you, and you may want to name them, and then ask the group, what 3 things would you all like to focus on for today's session? Okay. So this can be useful in the group setting to help the group become focused again. But again, you want to use it very carefully, because you don't want to leave anybody's single issue out that is very important to them. So that's kind of the trick of using this in the group setting, is someone else, 1 or 2 people may have a completely total issue that they really need to talk about, that the other group members say, well, we should focus on these things. So in the group setting, you may want to take a little bit of liberty on saying, I think we should focus on these 2 things from most of the group, but these one thing sounds very important to our group members here. So let's focus on those as well. So that's kind of a difference between individual and group focusing. Okay. Clarifying. Sometimes clients give a lot of information all at once that makes perfect sense to them, but can be confusing to the counselor to understand. Clarifying is a skill that uses a question to help the counselor get a better understanding of the client's story. While it may feel difficult to interrupt a client when doing clarifying, this means it demonstrates that you are trying and wanting to understand fully what the client is going through. It is also much easier to clarify at the same time than to let the client continue and then end up not understanding. So I want to kind of give the difference between the reflection and the other skills that we talked about earlier, okay? When you're doing a reflection with a client, what you're doing is checking your understanding. Did you hear it right? Okay. Clarifying is when you really have no idea where the client is going with their story or with what they're going through. Maybe they're jumping around. Maybe they assume you might know some things, and those types of things. So clarifying is different than reflecting or paraphrasing back, because with reflecting and paraphrasing, you're making sure you listened correctly or you attended correctly. Clarifying is when you're just completely confused at what the client is saying, okay? And so when clarifying, the reason why it's difficult for a lot of counselors is they feel like it would be inappropriate to interrupt and ask a question, okay? But if you do it correctly and say, instead of just saying, hey, I have a question, okay? Instead of saying, hey, do you mind me asking a question? Do you mind, you're saying this, and can you tell me more about that? And so it's about interrupting respectfully. And so I just wanted to note the difference between clarifying, reflection, and paraphrasing, okay? Clarifying is when you're totally confused about what's going on. Clarifying in the group setting is a little bit more complex for the facilitator, okay? Because in the group setting, your job is to make sure everyone in the group is understanding. So when someone's telling a story and you look around and you notice the body language of the other group members, they look confused or they don't understand, or you got to pay attention to the whole group's body language, so that when you notice that the other group members aren't getting it, as a facilitator, you can kind of jump in and say, hey, let's slow down and let's talk this through. I feel like there's some confusion or there's some issues, and then have some questions ready. Okay. And then there is, of course, the question of use of questions. In counseling, questioning should be used with skill of clarifying and understanding, not to probe or interrogate the client. This is something that is really important for the people who want to work with people who have experienced trauma. Because unfortunately, what happens a lot of time, especially with, traumas that are kind of taboo, such as child sexual abuse, such as molestation and all those kinds of things, there's a point where you have to have such a self-awareness and you have to ask yourself, are you being a voyeur and just want to hear what happened? Or are you being a counselor and trying to help this person work through what happened to them? Because to be honest, you could work with a trauma client and help them without you ever even knowing what happened in the trauma. Because your goal is to take what they're experiencing today and implement skills to help them work through the problem as they're experiencing it today, not as they experience the trauma back when the trauma happened. Okay. And so I challenge everybody to think about this. We're not police investigators. We're not probation and parole officers for the most part. There are opportunities to do groups in those settings, but even in those settings, the probation officer, the parole officer, or whoever should not be there to interrogate. And so we got to be very careful of this, because sometimes we just want to know because we ourselves are human and curious. Okay. So, and we need to know, the basic difference between two types of questions. So closed questions are how you're feeling today. Open questions are how are you feeling today? Are you feeling sad today? It's a closed-end question, excuse me. The example of the open-end question is how are you feeling today? Okay. And in the counseling setting, the best type of question you probably could guess is open-ended questions. Okay. And this does take some skill development over time, because it takes a kind of a rethinking of how you ask a question. So, most of the time when someone says, how was your day? You say, okay, right? It's almost an automatic response. But how are you feeling today? Or how are you experiencing your day to day? Those types of things that kind of probe a little bit deeper than just how are you, is kind of how you want to think about it. By using open-end questions, you allow the client to speak more about issues as opposed to responding to a closed question of yes or no. Okay. And this is the important part of this last bullet point, is always check in with yourself before asking a question to ensure that your reason for asking is at the client's service and not, for example, to satisfy your own curiosity. And this goes back to the last example. It's about having, and you remember that emotional intelligence conversation we had, that self-awareness that we've been talking about over and over and over in this class. Okay. You're not in the helping field to satisfy your curiosity. If you want to go do that, go be a law enforcement officer, an investigator, someone like that, a child protective social worker. But if you're in the helping field, if you're here to do counseling and treatment, we got to keep our curiosity in check. Okay. And it's a good idea to avoid why questions, which can sound judgmental on a client's actions, decisions. So that's another level of self-awareness I would encourage everybody to think about is, so one, you should be checking, am I asking this question for my curiosity or for the service of the client? The other one is making sure you don't ask why questions because it has a judgmental tone over it. So keep those things in mind as we talk about using questions. Okay. Summarizing. So this one is this one is one that I would encourage everyone to use in the group setting. Okay, this is one skill that is very important. It's different than paraphrasing. Paraphrasing is when you're checking to make sure you heard the client correctly or you heard the group member correctly. Okay. Summarizing is reflecting back the key points before you bring it to a respectful end. So it's just saying, so this is what we covered today. Try to keep the summary brief but meaningful and purposeful. This is where it's a good idea to make motivational statements like, we can do this week, and we can we had a lot of growth today, those kind of things. Okay. Summarizing can also start a second or subsequent section. It can actually let you know that your group needs to change a direction. When you hear yourself saying, this is what we talked about today, maybe the session for next week may not be the appropriate session, then that you may need to rework it when you summarize and say, this is what we're going to continue to work on. It is important, though, to make the client feel that they must continue the same thread. Okay. And so a summary is not an end statement. It's not a closed-ended thing. You're saying these are the key things that we talked about today. These are the things we've worked on, and these are the things that we're going to continue to work on as we move forward based on our session today. Okay, so again, paraphrasing is when you're doing a check for understanding about what your client said. Summarizing is reflecting back the key points from the session and providing direction of where you'll be going next. And then there's the issue of immediacy. This was first described, well, not first, but most popular described back in '93, when it was said immediacy, quote unquote, is the key skill of focusing attention on the here and now relationship of the counselor and clients with helpful timing in order to challenge defensive and or heightened awareness. Okay. What immediacy really is, and we're showing this in the research. This is becoming very, very clear in the counseling research, is making sure that your session is focusing on the client's immediate experience of what they're going through. Okay. It is saying how are you experiencing what happened to you in your past today? Let's talk about today. There's a popular meditation that talks about this. Mindfulness is kind of the same thing. What you do in mindfulness meditation is you continually, when you feel your brain drifting to the future or drifting to the past, you bring yourself focused into the here and now. Okay, this is kind of the same thing in using immediacy within the counseling session. Is sometimes the client does need to tell a story about their past because they feel that it hasn't been heard yet, and that's okay. But when a session continues to focus on the past, so for example, the client says, I just need to tell somebody this thing that happened to me. okay? And so they say that, and then the trick for the counselor is to bring that story and say, how is that affecting you now? How is that story? How did that experience? How does that experience trigger your symptoms in alcohol and drug classes? When you think back to that, does that make you want to use or those? And so it's always bringing things back into the immediate moment. All right. And what I mentioned earlier about what we're finding in research, a lot of traditional counseling, starting with the psychoanalyst with Sigmund Freud, was this assumption that in order to help a person, you have to go clear back into their past, into their childhood, into their relationship with mom and dad when they were an infant. And then you had to build this narrative story of what's happened to them in their life and those types of things. And what we have found more recently is that actually focusing on how the client is experiencing their symptoms now is much more productive and much more effectively than tracing the roots of that problem back to some childhood experience or teen experience or those kinds of things. Okay, we find what happens is when you focus on the here and now, what the person does as they start to heal in the here and now is they then go back and rewrite what happened to them in the past. They don't put as much importance on it anymore. They de-emphasize it. And they actually, if you work on the here and now, they will actually start building positive memories that they had in life and start de-emphasizing past traumatic memories that they had in their life because they're not as meaningful, because they're no longer triggering in the here and now to those past experiences. So that's the use of immediacy. And so kind of keep that in mind. In the group setting, again, it's about making sure the group remains focused kind of on the task at hand, on what we should be doing today. Sometimes in a lot of groups, especially when the groups become really close, they'll start to want to talk about past experiences and those kinds of things. And again, from a treatment perspective, that's not really an effective use of the group time. They can definitely, after the group or whatnot, have conversations if they'd like, but making sure that you're focused here and now. This is where you belong. This is where your clients belong. Okay. So I want to start talking about conflict resolution, and then we'll do some skills this Thursday dealing with conflict resolution. We'll look at some case studies and whatnot. But I want to kind of go over some of the basics of conflict resolution with the time we have left with each other today. So this is just kind of an introduction. It's the basics. And then on Thursday, we'll use some case studies to explore how to relieve conflict more effectively, okay? So what is conflict resolution? Of course, it's a way for two or more parties to find a peaceful solution to a disagreement. I don't know how to define it anymore, but that's what it is. One thing I would say is that conflict revolves usually not on the cognitive level, but on the emotional level. And that's where conflict really arises from, okay? Is that it starts with a misunderstanding and then the emotions start to take over. I think the best example I could provide, and I may have done it with this class already, is when we look at when a person goes through a stress response, okay? And so let's just kind of give an example of a typical stress response. Okay, let's say you and your partner, if you have one, or we can just talk more in general. Let's say we have a couple, and they have a rule about making sure we turn off all the lights before we leave. Okay. But oh and behold, one of the partners come home, and the other partner left most lights in the house on when they left. And so now there's a rule violation. All right. And so what do you typically do in this situation? Well, we are emotional beings, so we might get frustrated and whatnot. But what we start to do is we start to build our argument in our head. And our argument is very rational based usually. It's very, we think about it when that person gets home, we're going to lay this out. It's the bills, it's the light, all the energy, environment, all those kinds of things. We have these logic arguments. And then when the person gets home and you confront them, as you would say, I noticed you left the lights on today. Typically, in some cases, the person might say, "Oh, I'm sorry, I was in a hurry, I was late," or sometimes they might go, "It's no big deal." Okay. Now, I want you to think about what that sounds like. It means I don't understand you. This is ridiculous. And then what happens is then we start this conversation going back and forth, and our body starts to feel that stress. And it starts to go through a sympathetic nervous response. Okay, what that means in the brain is that when we go through a sympathetic response, blood flow and attention in the upper cortical areas of our brain, the rational areas of our brain, divert to go to the limbic system, the oldest part of our brain, the most basic part of our brain. Okay, because what our stress response says is we're in danger, we need to fight or flight. And so it needs to get instant information, it needs to understand the emotions going on. There's no time for this higher thinking stuff. And what are the ages we learned our most well-learned behaviors? Well, around 3 to 6 years of age. And so as the couple continues and they start going through the sympathetic response, then that's when they start calling each other, poo-poo heads. They start slapping each other. Sometimes it ends up in violence, okay? This is why when most people go to couple counseling, one of the very first things that the counselor does is they teach the couple to learn when they're at that moment, when the limbic system has taken over, and tells the couples, you guys need to separate. You guys need to separate 15, 30 minutes. You need to go do something physical, because a sympathetic nervous system is all ramped up with hormones and all those things. So they say, go for a jog, go hit a punching bag, but stay away from each other. And then in 30 minutes, come back and try again. Okay. This is how most conflicts are, is that we don't end up using the higher cortical areas of our brain. We start to use the emotional areas of the brain, and those emotional areas of brain, the most well-learned memories that it has to react on, were us between the age of 3 to about 6 years of age. Okay. So what I want to provide right at this moment is, remember, when people are in severe conflict, they're not always rational human beings. Okay, they're using the most irrational parts of our brain because they don't have access to the rational parts. Okay. Now, of course, why should we, especially in the group setting, why should we work on resolving conflict? Well, one is, if we do come back and really be able to think of things on that higher orbital area of our brain, we can come to some agreement that will benefit all parties. Okay. To understand those whose ideas and beliefs and backgrounds may be different from our own. And so bringing the emotions down so that we can have some type of understanding about each other's positions. But we can't do that until we bring that emotional reaction back out. I mean, we get that emotional reaction slowed down so that we can talk. Okay. To ensure that your relationship with opponents continues and grows. So you've all probably heard this time and time again. Diversity is important. So it's important to understand other people's perspectives, even though it might not fit your life. I will say in the group setting, a lot of times where I've seen a lot of conflict is when there's a group member trying to impose their experience onto another group member. So they'll say, well, when I experience this is what I should do, and you should do it because it worked for me. Okay. Now, giving experience is helpful, but to assume that your experience will be the same as someone else who has a different learned history, different human experience, different memories, maybe different life situations, to assume that your solutions will work for them is something we shouldn't encourage in the group setting. In that type of situation, we could say, what in Joe's situation, what did everybody else do to resolve their situation? But then when it gets to, well, Joe, you should do this because it worked for me, we want to kind of intervene on those types of statements, because a lot of times that's going to be the beginning of the conflict process. And of course, the last one is to find peaceful solution to a difficult situation. Okay. So what are the steps? So this is just the basic steps. And as I said, this coming Thursday, we'll work on these skills using some case studies. I always find it interesting is that we always start with understand the conflict. But as I just mentioned, in order to understand the conflict, we have to work on the emotional tone in the room. All right. And we'll talk a lot more about this on Thursday, about how do you get people who are ramped up back down to a level where we can start to understand the conflict. Okay. So understanding what's going on, maybe it's an argument about, what someone should do or not do. And so then communicate with the opposition. So in this situation, it's understanding how the receiver of the conflict is understanding the information. So this would be the receiver, understanding why they're reacting the way they are. And then this is the person who is kind of the initiator, the person who started, I don't want to say started the conflict, but began the conflictual interaction between each other. So in these kind of cases, it may be separating the two. It may be, let's take a group break and then going to both, those types of things. If it's a low grade conflict where there's not a lot of emotionals aroused and you've done a good job of gaining respect among your group members, it may not be necessary to take a break to come to understanding. You could just say, okay, well, hold on, everyone. I want to start with Jill. Jill, what are you feeling? What do you see the conflict is? And then Jill talks, and then you go to Joe. Joe, when you were trying to express this to Jill, what was going through your mind? What was your thought process? And then that. And then the next part is brainstorming possible resolutions. Okay. And then, you come up with that list, and then you mediate a conversation. And we'll talk about mediation a little bit on Thursday, about what does it mean to be an impartial mediator, okay? And then of course you explore the alternatives, okay? And this is an important skill that we'll look at again. One, we don't want that emotional tone to come back, that aggressive tone to come back. So we'll talk about how to cope in the stressful situation and look at different pressure tactics that individuals use when they're in a heightened emotional state. And then of course, the last one is choose the best solution, okay? Now, this is a process, but I know some people in the class have brought this up. The thing that is always kind of missing in these steps of conflict resolution is there's a whole bunch of stuff that happens right here. And it, like I said, it has to deal with brain processes on one end. It has to deal with different learned histories on another end. And so it deals with cognitive, social, and neurological things that are happening to the person. On the neurological end, you have a sympathetic nervous response going on. On the cognitive end, you're having this, I don't understand you, you're talking different than I am, I don't understand what your point of view is. On the social level, you have a relationship issue. So this social interaction, you're now going into what's called a power and control situation. And you have to manage that power and control interaction as a facilitator. Okay, so this is going to be a major area of focus, and then we'll go through the rest of these as we move along. Okay, all right, I'm going to stop there. I just wanted to give a good summary. I'm going to stop sharing.